Hi, I'm Gigi. I'm a dermatology nurse practitioner. I started my own virtual practice back in July of last year, and I feel like it's time to share my dermatomyositis story. I have consent from my patient that absolutely, if this can help anyone, if it encourages anyone to advocate for themselves, obviously keep her anonymous. There's gonna be two parts. I'll put the second part in the comments so it's easy to get to. This first part will be her diagnosis. Second part will be advocating. Her and I advocating for her. She found me through her primary care provider that I have a partnership with. So she was my first patient from this primary care office. She is 47 years old, family history of lupus. She starts out the visit by telling me I am the fourth person she is seeing complaining of these symptoms. Other people are just giving her very expensive medicine now because nothing's working. And I'm like, okay, that makes sense. Like probably topical steroid doesn't work. And then they're just like escalating to the new medicine. Her symptoms began in June. I'm seeing her end of August. And automatically I'm like, oh crap. Like she has something that 3 people, including a dermatologist, has not figured out in person. So I was like, did anyone biopsy this? No. Has anyone done blood work? No. So these are her symptoms. Back in June, her scalp and ears were oozing and burning. Her neck was getting red. Prescribed ketoconazole. That burned terribly. She went to another dermatologist. They give her triamcinolone cream. This also didn't work. She went to urgent care. They give her clotrimazole betamethasone cream. Again, no improvement. Now her whole neck and her chest has this rash. I saw another dermatologist. These are all in person. And was diagnosed with rosacea. She was also given fluocinamide oil for her scalp. She was also given doxycycline. She was then given ivermectin and tacrolimus, both topical. So I'm thinking something autoimmune at this point, especially things that come and go and like flushing. I just start going through my review of systems. Do you have any muscle weakness? Yes. Standing up from a chair has become very hard. She also has fatigue. She's only 47. Not a lot of comorbidities. So I'm like, this is bizarre. She holds anything up over her head, she feels very weak. She commented, this feels like it's affecting her whole body. Go through the rest of the review of systems. I'm like, any difficulty swallowing? Oh yeah, it's hard to get pills down the last few weeks. And I'm like, oh no. Burning. She had some nail changes. She had a tender lump on her wrist, short of breath at times, inhaler PRN, a little bit of joint pain. Me being the 4th person she's come to, I'm like, well, we're about to work up the crap out of this. So I looked up all the labs to order. I recommended punch biopsy, at least 4 millimeters on an active area. That's not had steroid applied. I think she should get a CT, chest, abdomen, pelvis. Treatment. I want her to get the labs done ASAP, and then I was going to put her on prednisone. I didn't want the prednisone to interfere with anything. Urgently refer to rheumatology. At this point, it's Saturday, and I have tried not to freak her out, but I'm like, you know, you could have this very rare autoimmune like type of rash. I sent her the Visual DX page for dermatomyositis. She then like reads it and portal messages me her other symptoms she's having that are consistent with what she was reading. And she's like, oh my God, I think this is it. And this is the first patient I'm like, I feel like I have to. Not that I have to get this right, but I don't want to be like, oh my God, this is like super rare diagnosis, and it's not. Faxed them my note. I called them on Monday. I said, you know, I sent an email, I faxed something. This is not an emergency, but it is very urgent. They bring her in immediately. They do the punch biopsy from her wrist. That comes back as suspicious for lupus or dermatomyositis, is what the pathologist said. They do all the blood work. I then prescribe her prednisone. She also needs to go to a rheumatologist, and so she already started working on that, and they gave her an appointment in February, and it's late August. So I'm like, well, that's not gonna work. That's who the rheumatologist was. She gave me their phone number, and so I called. They have an operator. I've had to call them several times. They actually called her and then moved her appointment up to beginning of October. So she really only had to wait about a month. Mid-September, prednisone's not working so hot. Her like eyes, she now has like that heliotrope. They're prescribing her like allergy drops, antibiotic drops. It's all making it worse. And I'm like, this is just the dermatomyositis. I put her on methotrexate and prednisone for 2 weeks. I'm just trying to get her to that rheumatology appointment. She gets in with rheumatology. They switch her to an injection of methotrexate, and they've kept her on the prednisone. So I was like, ooh, I was right. And at this point, I thought I was done. And we had like a video follow-up, and she just like fills me in. And I'm like, you have my phone number. If you like ever need anything, you know, I'm here. I'm very easy to reach is what I tell everyone. Part 2 is coming next.